To anybody to anybody who wants to, get into tech. We are very committed to making the technology sector very much accessible to them. And we do this by offering you premium experiential training in data analytics, business analysis, data engineering, data science, financial analytics, HR analytics, agile project management, cybersecurity, AI engineering, and finally, why we're here today, health tech. All right. Now we have a team of wonderful instructors from leading global companies around the world, like Microsoft, Apple, McKinsey, Amazon, PwC, and so on and so forth. Now, what this means is that we're bringing people who have actually walked the talk, people who have gotten their hands dirty, people who are already working in these roles to come and share their experience with you and teach you based off of what they have learned on the field. Now, what that means is you're not going to be learning from a textbook. We don't do that here at Analytics, right? You're going to be learning from experience and you'll be learning using practicals. Now, these wonderful instructors that we have bring a wealth of real world experience as well as, dedication to delivering an engaging and practical learning experience for you to ensure that you are able to receive the maximum value from your investment with us in the future. All right. Now, who is this person that has been speaking to you for the past 8-ish minutes? My name is Elizabeth Nana, and I am a product manager. I am a senior agile project manager and also a clarity coach here at Analytics with half a decade of experience in product and project management. Now, I'll call myself a skilled leader, all right, and also a coach for agile teams. And I've been able to consistently drive impactful results across different organizations, across different regions. As a clarity coach, I have been able to help aspiring professionals such as yourself. That is what I do, okay? I help aspiring professionals gain direction. I help you gain confidence and also know the actionable steps that you need to take in order to transition into rewarding tech careers. I have personally also trained over 1,000 professionals across 4 continents, and my experience spans multiple sectors like health tech, fintech, legal tech, as well as ed tech, where I've been able to apply my deep knowledge of agile methodologies to deliver value and transformation. Now, enough about me. Let's get right into what it is that we want to do here today. Now, the first thing we're going to be talking about is the high demand tech roles in healthcare. There are a lot of roles that are in demand right now, and they're emerging, rapidly emerging across the different regions. I'm sure if you have been online, if you've been searching for jobs, you must have come across healthcare informatics. Now, a lot of people do not even know what that is about, right? But today, I'm going to be showing you some of the high in demand tech roles and how you can also get into it. Now, what these roles will do for you is that they're still within the tech ecosystem. They're within the tech ecosystem and they're also within the healthcare system. They're within the healthcare sector, but it's going to take you away from doing bedside care, okay, to making sure that you are able to have a work-life balance. Now, the link that I spoke about earlier, my colleague just dropped it in the chat, the attendance form. It is very important. If you'd like to get a recording of this session as well as my slides, please go ahead to fill the attendance form. Just click on that link, fill that form with your details, and then we'll be able to send the slides and the recording of the session to you via mail. All right. Now, some of the high in demand, tech roles in healthcare are healthcare business analysts, healthcare informatics specialists, you have healthcare data and reporting analysts, you have medical data analysts, you have healthcare data analysts, you have, pathology data analysts, you have clinical data analysts, clinical decision support analysts, medical imaging analysts, healthcare engineer. Now, one thing I want you to just focus on across these different roles, these multiple roles, is that you see that they're still in healthcare, right? But now it is merging health. I mean, that's where the name comes from, right? When you hear health tech, it's merging healthcare with technology. What that means is you're able to work remotely. You're able to, get a high paying job. You don't have to interface with patients. You don't have to offer bedside care. You're still able to do what you enjoy doing with your experience, your wealth of experience, and then you're able to do it in a better way and earn more money for yourself. Now, we have a lot of people. When I started this session, I mentioned that we've helped over 3,400 people, right? I could spend all day here today. We could be on this session for 5 hours talking about, testimonials and success stories. But I'm going to highlight a few of them so that you understand that this is something that we've been doing for people. And, you can also make it in my slides as well. I can also speak to other people and say, look, we helped XYZ move from being, a medical doctor into, healthcare informatics or clinical data analyst or biostatistician in tech. All right, now let's take a look at the story of Sharon. Sharon moved from healthcare. She was a healthcare assistant, with the NHS in the UK. And she was able to move from that to becoming a business data analyst in less than 3 months with us. Now, there's something that Sharon did, because I mean, she has taken a look at herself. She has taken stock of her life and she knew that she wanted more. All right, she wanted more for herself. She wanted more, using her experience. And of course, if you have ever worked in that role, healthcare assistant, you understand how grueling it can be and the hours that you have to put in. And then the pay is not the best. Now, she joined the 10 analytics training, in March of 2025, and she was able to secure a job as a business data analyst with the same organization, with a sponsorship intact. Now, what that means is she was working at the NHS, right, as a healthcare assistant. And then she upskilled, she leveled up herself, and then she got promoted, still within the NHS, still with her sponsorship intact. I know that, a lot of people have questions around that as well. How can I be sure? I'm currently working as a care worker. That is what is offering me my sponsorship right now. If I transition, is it going to affect me? Am I going to start afresh? Will it increase the number of years I have to spend before I can get my ILR? I'm sure a lot of us have those questions in mind. And the answer is no. It will not affect you in any way because all you have to do is simply switch. Or in Sharon's case, you have your sponsorship intact. You are simply promoted within the same organization. Now, all of these testimonials are linked here on my slide, right? So make sure to fill the attendance form so you can get my slides and then you're able to watch all these testimonials on your own. All right, now, across the different success stories and testimonials I'm going to be sharing with you, you're going to notice that there is a pattern. There is a three-pronged approach that we follow here at 10 Analytics, and this is a tested and trusted strategy that have been able to help thousands of people land jobs. Now, the first thing you want to do is you want to identify what you want to get into. And I've made it very easy for you. Health tech, simple and short, right? So Sharon joined 10 Analytics. She started taking a program with us in March of 2025. And, we taught her how to tailor her CV. We worked on her CV for her. And then instead of just giving you fish, because we don't just do that. We give you fish to eat, but then we also teach you how to fish. So we worked on a CV for her, and then we taught Sharon how she can also tailor a CV. So every single time she wants to apply to a job, when she sees some keywords in the job description, she can also edit a CV and add those keywords to make sure that the CV properly aligns with the job description and she's able to beat the applicant tracking system, which is an AI that is being used, today to screen out, CVs and resumes. Now, Sharon also joined all the mentorship sessions that we offered. She got strategies on internal applications. How can she apply? What are the strategies that she can follow? What are the strategies that she can deploy to get what she wants to get? And she also built a portfolio. Now, building your portfolio is very important because, again, I love to use this word, proof of concept. Your portfolio is what shows your recruiter, your potential employer, that you know what you're doing. Anybody, absolutely anybody can come up with a fantastic CV. I could write a fantastic CV for my 5-year-old niece, and it's going to look like she has all the experience in the world. All right. But then when it comes to proof, how do you back up everything that you have on your CV? That's where your portfolio comes in. So I want you to think of your portfolio as a workshop. If you are, you work in furniture making, for example, right? There's a showroom or you want to buy a car. When you want to buy a car, you go to a showroom, you test drive a couple of cars, you ask for specifications. Oh, does this have a turbo engine? You ask for everything that you need to know before you settle on the best car for you. Now, imagine if they did not give you that opportunity to go into the showroom. you're going to be confused, right? You might not want to buy from that dealership. You might want to look for another dealership that has a showroom close to you that you can visit and actually see the kind of cars that they have. Now, that's exactly what your portfolio does for you. So when you have your portfolio linked on your CV or on your resume, when you submit a job application, recruiters, even before reaching out to you, they look at your fantastic CV and they're also able to take a look at your workshop. They're also able to go into your workshop and test drive the cars, meaning the projects that you have, in your portfolio. Now, this is what improves their confidence and it increases your chances of getting a call back for an interview. Now, Sharon applied internally, of course, within the NHS to available jobs so that she could keep her sponsorship. And in May of 2025, now remember, she joined the program in March of 2025. In May of 2025, less than 3 months after joining, she landed a job as a business data analyst within the NHS, and she kept her sponsorship. Now let's take a look at, let's take a look at Pavel. Now, Pavel had a completely different background from Sharon. Sharon was a healthcare assistant. Pavel was a teacher back in Cameroon before, moving to the US. He joined the health tech program as well, and he was able to land a job as a healthcare data analyst in the US. Now, again, you also notice the path that Pavel followed. He joined the program in December of 2024. We taught him how to tailor his CV. He joined all the mentorship sessions. He got prepped for multiple interviews because that is also a service that we offer. Now, it doesn't matter how many interviews you get, right? It does not matter. If you get 200 interviews, we will prep you 300 times because at the very core of what we do, we want to make sure that you get the job beyond the training. We want to make sure that you are able to land that job. You're able to transition from where you are at currently into health tech. If you need a remote job, if you need to spend more time with your kids, if you want flexibility, if you want stability, you don't want too much stress, we're able to make sure that that happens. It is our job. It is our responsibility. I always tell people it's probably even more important to us that you land a job than it is important to you. That's how dedicated we are. So we prepped Pavel for multiple interviews and he got multiple job offers. Now, here's what is very interesting. Pavel got multiple job offers and he was able to sit down and analyze these different job offers and choose the one he liked best. Now we had options. That's just what it meant. And that can be you. Now, Pavel, unlike Sharon, did not even have a background in healthcare whatsoever. Pavel was just a teacher. So this is also to show you that regardless of your background, right, whether you have a background in healthcare right now or you do not, but you have an interest in health tech, then you want to also be in this session. It's not too late. Make sure you are sending the link to the session to anybody you feel can benefit from this session and make sure to fill the attendance form. Now, Pavel also applied to multiple jobs that we provided him with and focused on building a very strong portfolio. After we taught him how to tailor his application, he was making sure that he was tailoring every application. Now, I want you to note the timeline. Pavel started or completed this program in 2024, December 2024, and by March of 2025, he landed a healthcare data analyst role in the US with the Arizona Community Physicians in Arizona. Remember, this is someone who did not have a background in tech. Now, let's take a look at Ikmat. Now, I'm just going to breeze through this. Ikmat went from being a stay-at-home mom in the UK to being a data analyst with the NHS, all right? Ikmat was staying at home. She was a full-time stay-at-home mom for 2 years. So she had taken 2 years off of work, right? She had a 2-year employment gap. She moved to the UK for a master's in public health. Now, this is also to show you how individuals with a master's in public health can also benefit from this. Now, Ikmat wanted more, of course. And what did she do? She joined the 10 Analytics, health tech program as well. And she knew that more than just a job, she wanted a job that would offer her sponsorship, visa sponsorship. That was Ikmat's goal. And then in January, she landed an information analyst role with the NHS with full visa sponsorship. Again, you don't have to take my word for it. All of these different testimonials, all of these different success stories are linked on my slide. So once you get the slides, make sure to go through them. Now, what is the second thing that you need to know? You need to be able to identify the skills that are required to land a job as a healthcare data analyst. You want to make sure that you are learning the right way. Now, before I start to tell you what the right way would be, I want to answer. I know there's this question on a lot of us right now on our minds, right? What exactly does a healthcare data analyst do? All right, because it could sound like a buzzword right now. You want to know what exactly does the role entail. Now, I'm going to give you a quick analogy. I love to tell stories a lot, so just bear with me. But I find that storytelling also helps you to understand better. So now let's say a mid-sized hospital right now is facing ICU congestion, right? And there are bed shortages, there are rising inpatient costs. Now, in order for them to improve their bed utilization, in order for them to improve their patient flow, in order for them to improve their cost efficiency and their quality of care. Of course, you know that these are things that are very important for hospitals. The hospital leadership wants to know how length of stay, which is what I refer to as LOS, varies by medical condition, by department, and also by bed type. So they have some questions, basically. That's just what it means, right? Now, the hospital leadership, they want to know how the length of stay varies. So if this patient has diabetes, for example, how long does this patient have to be hospitalized, right? If this patient is in this department, how long does this patient have to be with us using a bed? And then what type of bed are these patients using, right? So which medical condition has the longest length of stay? Which department has the longest length of stay? What types of bed have the longest length of stay? Those are the three questions that, the hospital leadership has. Now, what exactly does a healthcare data analyst do? Now, in every organization, whether you are in healthcare, whether you are in any other organization at all, even here at Analytics, there is always data. Now, what you can see on my screen is a snapshot of, a sample, data, patient's data. That's what you're seeing. Of course, this is not real. This is just a sample, right? So you're seeing a sample of what patient data would typically look like. Now, the healthcare data analyst collects this data. The data already exists, by the way, right? Now, hospital leadership, even though they have this data, they don't exactly know what to do with it. Now, what does the healthcare data analyst do? You first collect and analyze this data. You want to make sure that you're categorizing them well. You can see the different columns, the visit ID, the patient ID, the admission date, the discharge date, the length of stay, medical condition. You want to make sure you're categorizing everything, right? Even the department, the doctor ID. Who was the doctor in charge? The hospital bed, was it, in the general ward? Was it in the private room? And so on and so forth. Now, notice how all of these are being categorized, right? Now, using this data, the healthcare data analyst is able to analyze them and then look at the conditions, the medical conditions that have the longest length of stay, right? So is it hypertension? Now, from this snapshot you're seeing here, it is tumor. You see tumor leading with 12.6%, and then you also have cancer leading with 12.3%. Now, how exactly did the healthcare data analyst arrive at this? How did they build this dashboard? Of course, I'm going to be walking you through that. But then the healthcare data analyst is able to use, this data, this table that you can see here to build this dashboard and carry out an analysis. And then from this analysis, the data analyst, the healthcare data analyst is able to identify the two medical conditions that have the longest average length of stay in the hospital, and that is tumor and cancer. You can see every single thing categorized. Allergist is the lowest, it has about 2.0. Asthma also has 2.0 as well. Now, aside just looking at the medical conditions that have the longest average length of stay, the healthcare data analyst is also able to identify the departments that has the highest average length of stay. And then using that same data, the healthcare data analyst is able to find out that oncology is leading with an average of 12.4 days. And after oncology, we have neurology, which is 8.1 days. Now, from what I'm explaining, you see that you don't actually have to be interacting with these patients. You don't have to be offering bedside care. All right, you just need the data and you need your laptop. You can work from anywhere. You could be in the Bahamas. You could be at home with your kids. You just need to have access to that data so you can carry out your analysis and make sense of it. And then you're able to prepare a report for hospital leadership. Now, once this report is shared with everybody, you agree with me that when you share a sheet, I'm going to call this a sheet like this with leadership, They would struggle. I mean, when I showed you these sheets, I'm sure you wanted to take some time to read through it. You're like, okay, what am I looking at here? But then when this dashboard is built and a report is prepared like this and sent to hospital leadership, at first glance, within 5 minutes, all of their questions have been answered. They're able to see the medical condition with the longest length of stay. They're able to see the department with the highest average, length of stay. They're able to see which rooms or which type of beds, have the highest average length of stay. Is it private rooms? Is it the ICU? Is it the general ward? Is it semi-private room? And then there is a summary. There's also recommendations attached. So you're able, because you are the data analyst, you're the one that took a look at that data, you're also able to offer recommendations and say, I think this is what we can do to help us improve our quality of care, to help us, improve how much we're making as an organization or as a hospital, and so on and so forth. Within 5 minutes, you're able to give them this report and they understand it. That is why these people are very important in hospitals or even in healthcare. Nobody, I'm going to go back to this chart again. Hospital leadership does not have the time. So you see how important your job is going to be. Hospital leadership does not have the time to go through this sheet. And you can imagine there could be thousands and thousands of data on this. But you are able to carry out an analysis using techniques that I will walk you through, I will show you, and we will teach you, and you're able to prepare a comprehensive report just like this. All right, now moving on. Give me a minute. Now you see how this table, we were able to translate this very scattered table, right? With thousands and thousands of data, patient information that, would overwhelm anybody. If you send this to anybody, the first thing they're going to feel is overwhelmed, right? They're like, where do I start from? But you, with your skills, you're able to translate that into a very easily understood dashboard or reports that, would be able to give hospital leadership that insights that they need, and also with recommendations on what they can do better, how they can improve. That is how important you are. You are a professional, basically, who would analyze the healthcare and clinical data to support better medical decisions. Now, what is going to come out of this report is that nobody is going to have to guess. Nobody is going to be confused. They are very clear on the path to follow. They already know the departments, they know the medical conditions, they know the type of beds. It is very, very clear. And then they're able to make, a better decision based off of the data that you have provided them with. And because of this, they're able to probably reduce their costs. They're able to improve their operational efficiency and also patient outcomes in hospitals. Now, if you go back to what I said earlier, I said, as a healthcare data analyst or someone in health tech, right? You're not treating patients, you're treating the healthcare system. You're helping hospitals make better decisions that would help to improve the quality of life for patients. So in a way, you're also improving patient outcomes. Now, a healthcare data analyst can work in hospitals and health systems. You can work in health insurance companies. You can work in NGOs and public health organizations. You can work in government health agencies. You can work in health tech companies, pharmaceutical companies, and so on and so forth. Now, some of the mistakes that a lot of us on here, despite the fact that we have a wealth of experience, some of the mistakes that we are making are you are learning by watching only videos. I know someone on here, I think that was Kiana. Kiana mentioned that she's a data analyst, you know. So Kiana, kudos to you. I'm sure you are very, very qualified. And some people that want to be like Kiana, and you also want to become a data analyst. Now, the problem that a lot of them are making, or a lot of professionals such as yourself are making, is that you're learning by watching only videos. You're probably going on YouTube. You're like, I've heard a lot about data analytics. I already have my background in healthcare. So how about I just go online, go on YouTube? There are a lot of free videos and free resources on YouTube that I can watch, and then I start applying to jobs. That is a mistake. All right. I'm going to be explaining why shortly. But you want to make sure that you are learning in a project-based environment. In fact, all of the mistakes I have on my slides here, they're tied to one thing: You want to make sure that you're learning in a project-based environment. You want to make sure that you have somebody that is holding your hand. You have an Elizabeth. You have someone like myself that you can talk to when you are blocked. Now, the problem with watching all of these videos and then some online courses where all you have to do is watch videos, the problem with that is that when you don't understand something, there's nobody to reach out to. Yes, you have paid for the course or you're watching the video. Now you get to, one part of the video that you're trying to replicate, but you don't know how to do it. You're not getting it. Now, who do you run to in that moment of need? You don't have anybody. So that is the problem with learning by watching only videos. You need somebody to hold your hand. So even if you're going to be watching videos, you need somebody to come back and say, "Hi, Elizabeth, I was watching a video and, you know, XYZ was said." Now, I'm not sure I fully understand. Can you shed more light? Can you explain to me? Or can I share my screen and show you, the problem I'm having? I was trying to replicate what I saw in that video, but I wasn't getting it. And you're able to get guidance. It is very, very important. Now, what is the second mistake that a lot of people are making? They don't have any real projects. So yes, you have a wealth of experience in healthcare. You have been working for 10 years as a support worker, 10 years as a midwife, 8 years as a nurse, 5 years as a doctor, and so on and so forth. You have the experience. Now you're looking to transition into health tech, right? But you don't have any tangible project in health tech that you have worked on. Now, as much as you have the experience, recruiters again want to see your portfolio. And what is going to be housed in your portfolio are projects that will be related to health tech, the fields that you're trying to get into right now. Now, they don't care that you have treated, excuse me, your recruiters don't care that you have treated 1,500 patients. They don't care about that. I mean, it could factor in, but you can't come to an interview and just tell them, I've been a doctor, I've treated 1,500 patients, I've done this and that. That is not enough. They need to be able to see your portfolio. They need to be able to see real projects. Now, how does working with projects help you? What it means is that you learn by actually doing. You don't just learn by watching videos. You don't just learn by listening to Elizabeth talk. You are actually doing it yourself. Now, let's go back to this, this sample patient's data and then how it was transformed into a dashboard. I'm sure, of course, a lot of us on here were very fascinated when I showed you the reports, right, that came out of this messy data. Now, you are going to learn how to do this, and you are going to learn how to do it and be able to explain it to any recruiter. So when they ask you, how did you come about your report? You are able to defend your report anywhere, anytime. Now, these are the types of projects that I'm talking about. So you're not just learning by saying, "Oh, Elizabeth said this and Elizabeth said that." You are doing it yourself. And what that does is it also helps to improve or boost your confidence. Now, I see a lot of activity going on in the chat. So if you have questions for me, just make sure. Thank you, Kiana. Kiana says, "YouTube is simply not enough." Make sure to put your questions, put your comments in the chat. Once I'm done with this session, I will come to the chat and, just look through and answer whatever questions that you must have asked. Just make sure to stick around till the end of the session. All right. Now, you are learning by doing. That was what I was talking about. You get to work on real projects. Now, what is the third mistake that a lot of people make? No local work experience in health tech. You're trying to break into tech in the UK, trying to break into tech in the US, right? You don't have UK work experience. You don't have US work experience, right? This is a hurdle that a lot of us professionals have. And what if I told you that 10 Analytics is here to also help you bridge that gap? All right, because of course, when you're applying to jobs, they're going to ask you for experience. They want you to have experience. They want to know that whoever it is they're bringing you, you're not coming to learn on the job. Because trust me, I was having a session, a few days ago, and I mentioned that recruiters right now, they're not looking for someone to learn on the job. They're looking for someone that can, land on their feet and start helping them in the organization as fast as possible. So in order for that to happen, they're looking for someone who has experience. So they're not willing to take a chance on a beginner. They want someone who has experience. Now, if you're a beginner, right, in order for you to get experience, you need a job. But in order for you to get a job, you need experience. You see that you're stuck. But then that is why we're here. And that is exactly where 10 Analytics comes in. Of course, as time goes on, I'm going to be explaining in more detail, but we are also going to help you bridge that gap in work experience for you so that you're able to land these jobs. Remember, this is a strategy that has helped over 3,000 people. So it is something that actually works. Now let's take a look at the fourth mistake. The fourth and most common mistake is generic CVs, generic looking LinkedIn profiles. All right. So you get CVs or you have CVs that, you probably worked on with the help of AI, right? You worked on those CVs, you just tried to do it yourself, and then you're trying to do all of that. You're trying to do this yourself. You have a CV that does not have keywords, industry keywords, because again, that is something that is very important. That is something that they look out for. Now, I'm going to let you in on a little secret. When we apply for jobs, a lot of organizations right now, especially in the global markets, use what we call the applicant tracking system. Some of us on this call may be familiar with it, but just in case you're not, I'm going to try my best to explain it very simply. So the applicant tracking system is like a security guard, all right? A digital security guard. Now, this security guard has been told if anybody submits their CV to you, right, to the security guard, I want you to scan the CV. Of course, it is AI, so it happens in a nanosecond, literally. So this security guard, which is the ATS, the applicant tracking system, has been told, once someone submits their CV, scan the CV very quickly, look out for words like Kiana, look out for words like Jones, look out for words like, health tech, for example. These are random words, by the way. But then that ATS has been fed with words that it should look out for on your CV. Now, what that means for you is that if you have a generic CV that does not contain those words, the moment, in fact, the second that you hit apply or submit on your job application, that application, that CV is flung in the trash. So a human being, an actual recruiter does not even get to see your CV. That is what it means. And that is the danger with using generic CVs. Let's talk about LinkedIn profiles. If you just have a generic LinkedIn profile, when recruiters stumble across your LinkedIn profile, they take a look, they're not impressed. You are not going to be able to land jobs via LinkedIn. Now, we also have a lot of participants who have landed their jobs via LinkedIn, right? They were minding their business, going about their daily activities. They got a message, a direct message from a recruiter on LinkedIn telling them, oh, I came across your profile, your LinkedIn profile, very impressed. And we currently have an opening. Would you like to, sit down with us and have a conversation? And just like that, they landed an interview to a job that they did not even apply to. So, when you have a generic LinkedIn profile or you have generic CVs, you have no idea the amount of harm that you're causing to yourself because you keep applying to jobs and you probably will not be getting a response. And then you'll be telling people that I've been applying for the past 1 year, I've been job hunting, I've been trying to get jobs, but I've not been able to, I've not gotten any positive feedback. It is because your CV is generic. Now, if you remember when I was sharing success stories earlier, I talked about tailoring your CV, revamping your CV. These are services that we offer. Again, very shortly, I will be, doubling down on these to explain, at length all of the employability services that we offer and how we can help you stand out and not just stand out, but land your job in health tech within 6 months. Now, let's move on. We also have, the fifth mistake, which is that you don't have these professionals that are trying to transition. You don't have a professional mentor. You don't have anybody that is going to mentor you through the process. You don't have anybody that is going to prep you for interview. So say you submit your generic CV and you are lucky and you get called back for an interview. You attend the interview and then you don't get called back. You don't get the job, right? Because you didn't have anybody to prep you. Of course, every single one of us, once you get a call back for an interview, you get the jitters. You're nervous because you don't know what to expect. You don't know the angle the question is going to come from. Again, that is where we come in here at Analytics because we're going to prep you for the interview. Now, we'll ask you to submit, some details, the job description, the name of the organization, and so on and so forth. And then we're going to go and do research and then come back and have a session, a one-on-one session with you, where we're going to tell you, now, Kiana, for example, these are some of the kind of questions that you should expect. Now, once you get asked these questions, this is how you should answer the question. This is what you should say. This is the framework that you should follow. This is the approach that you should use. Now, what this means for you is that by the time you go into the actual interview, you're at least 70% prepared for the kind of questions that will come up. And then, of course, it boosts your confidence, right? Remember that when you are going to be, going into these interviews to talk about projects, you're going to be talking about projects that you worked on, projects that you have in your portfolio that you worked on by yourself. So regardless of the kind of questions that are being asked, because it's something you did yourself, you're able to defend your CV as well as defend your portfolio. Now let's move on. What are the things that help you? What are the things that you don't even know right now? The tools in your arsenal that you don't know right now that you already have and would give you, the upper hand. The first thing is domain knowledge. I mentioned earlier, you're already in healthcare. You already understand how the system works. You know all the loopholes, you know all the problems with the system. So who better to fix a system than someone who already has experience, with that same system? So you have domain knowledge in healthcare, and then you want to make sure that you get data analytical skills, all right, to be able to analyze data. And that is how you're able to land a job in health tech. Now, what are the key learning areas? What are some of the things that you'll be learning with us? You learn how to problem solve, how to solve problems as it relates to your data. What is this data saying? Do we have messy data? Do we have bad data? Do we have incorrect data? How do you solve it? What are the different techniques you can use to solve these problems? Techniques like your Pareto principle, techniques like your five whys. For some of us on here who have kids, you know how adorable and sometimes annoying kids can be, when they just have constant questions. You see, a kid would ask you, mommy, where was I when this picture was taken? And you probably say, so I can hear someone's mic is unmuted. Please let's try to mute our mics. So your child might ask you, your child might have a picture of you, see a picture of you, maybe before you got married, and says, Mommy, I'm not in this picture. Where was I? If you have a toddler. And you say, oh, you were not born yet. And the child says, why? And you say, oh, I have not met your father yet. And the child says, but mommy, why? And it can get very annoying. You're just like, please leave me alone. But that is an example of a very powerful framework that a lot of us do not know exists. You want to ask why. Now, the premise is that if you ask why enough times, at least 5 times, you'll get to the bottom of the problem. So if there's a problem right now, you want to ask why. All right. So we don't have a lot of people on this session. Why? Well, we don't have a lot of people because not a lot of people found out about the session. Why did a few people find out about the session? Oh, a few people found out about the session because, people did not send links. Why did people not send links? Oh, people did not send links because people did not receive the link to the session. And that is how you're able to find the bottom, the root cause of that problem. So it's called root cause analysis, right? And I just gave you a snippet, but it's a very, very powerful technique. It sounds very simple. It's simple and it's very powerful. And it's a technique you can use to solve problems, whether in your day-to-day life or problems that relate with data. Now, you also be learning how to use Excel. If you remember earlier when I was showing you the sample patient's data, it was on an Excel spreadsheet. Now you learn how to use Excel like a data analyst, like a data specialist, like a data person. You're not just using Excel as a spreadsheet. It's not just a spreadsheet where you put information, but then how are you able to clean and analyze that information that is on the spreadsheet? How are you able to understand and generate insights from the information on the spreadsheet? How are you able to transform that information, that data that you have cleaned into a dashboard that you can then send as a report to leadership, right? We're going to teach you how to do that and not to worry. Again, I mentioned, regardless of your background, you don't need to have a background in tech to do. All you need is the interests, because this is absolutely beginner friendly. Anybody, it sounds hard, from the outside looking in, but anybody, I assure you, anybody can actually do this, regardless of your discipline, regardless of if you have any prior tech experience or not. Now, I saw a question in the comments earlier. Someone was asking, I don't want to code. I want to get into something that doesn't require coding. That is why you're here. You're in the right place. Now, you will not be coding whatsoever. You're not going to write a single line of code. All you have to do is analyze and interpret data for organizations to help them make better decisions. You are not going to be writing a single line of code. So that is not something that you have to worry about. Regardless of your age, a lot of people think, oh, I'm too old. My brain is not as sharp anymore. Believe me, I understand. A lot of us who have been out of the classroom for years. That is why, again, when I tell people about tech analytics, I like to tell them, think of it as you coming into a health tech kindergarten class. Because best believe we're going to take everything from the foundation. We're going to make sure that you even understand the concepts. Before you start building dashboards, you need to even understand what it entails. What is a dashboard? You need to understand how to even analyze and interpret data, how to make sense of data. What are the foundational or fundamental concepts that you need to understand? And these are the things that we're going to teach you. So it is absolutely beginner friendly. We're also going to teach you what we call SQL, the language of the database. SQL is how you communicate with your data. Now, you agree with me that, if you meet someone, for example, maybe you speak English and the person doesn't understand English, the person only speaks Spanish and you don't understand Spanish, you're not going to be able to communicate with that person effectively, right? But now SQL is the language of data. We're going to teach you how to speak the language of data. So when you're presented with data, when you have a spreadsheet, patient information, you're able to speak to that data, not literally, but you're speaking to that data to say, what is the problem? And then the data is responding to you and you understand the language. The language of the database is called SQL, and we're going to be teaching you that. Now, we'll also teach you how to use Power BI and Tableau to visualize your report. When it's time to share reports with leadership, with management, how do you take that messy spreadsheet and build a dashboard and add your recommendations and add your key insights so that whosoever, gets that, and that is also number 6, data storytelling. Anybody that gets that within 5 minutes of receiving that report and taking a look at it, they have understood everything. Now, you want to make sure that when you are translating something, when you get data, you have gotten the insights that you need from your data, you are explaining it in such a way that whoever you send your report to, whether that person is a data specialist or is someone in college, that does not have any experience with data whatsoever, whoever receives that report, after taking that report for 5 minutes, they understand exactly what that report is saying. So how do you craft your insight? How do you craft your data in such a way that it tells a story? All right. It tells a story. It tells a story that is easily understandable. Anybody that takes a look at that report, they're able to understand it, see your recommendation and say, interesting. So this is what we need to do. You want to make sure that you're learning, because it's one thing to understand data. It's another thing to be able to now explain to other people, explain to management, explain to leadership the insights that you've gotten from that data. Then in this era, in this day and age, in this time, AI is very, very important. All right. Now, we want to make sure that you are not made redundant because, again, we also care about job security and stability. So as much as you're on the hunt for remote jobs, you're on the hunt for jobs that will offer you visa sponsorship, flexibility, a better quality of life, and so on and so forth. We want to make sure that by next year or in the next 2 years, you are not made redundant. And how do we do that? The best way to do that is to infuse AI into whatever it is that you do. It is never AI versus humans. All right. It is AI with humans. So you will also learn how you can leverage AI to your advantage, how you can make AI work for you. So instead of AI taking over your job, you're making AI your intern. AI is working for you. AI is making your work easier. AI is making your work faster, and you're able to get your insights, generate your reports faster than you normally would. Maybe it was a task that would have taken you 5 days to complete, but because you know how to use AI to your advantage, you're able to do it in under 30 minutes. Again, this is something that would impress, management in the organization because they were asking for a report, and in the next 30 minutes, you were able to generate that report. So we're also going to teach you how you can leverage AI. And then last but not the least, we'll be teaching you how to use Microsoft Fabric for analytics. Now, like I said, this is a no-code role. Now, what are the tech jobs in healthcare? In order for you to land these jobs that I mentioned earlier, healthcare informatics, clinical data analyst, public health analyst, biostatistician, and so on and so forth. In order for you to land these jobs, what do you need to do? The first thing you want to do is you want to learn in a project-based environment. What that simply means is you want to learn by doing the real work. It's simple. You're not just learning by watching videos on YouTube. You want to work on actual healthcare, health tech projects. So you're able to work with sample patients' information. You're able to build your dashboard. You're learning by doing it yourself so that when you get on the job, you're also able to do it. All right. And then the second thing you want to be able to do is you want to be able to showcase your work. How do you showcase your work? by building your showroom. What exactly is your showroom? Your showroom is your portfolio. All right. So it's not enough for you to learn the skills. You also want to make sure that you're showcasing the work that you've done. That is how you land a job. Now, some of the projects, these are just snapshots, some of the projects that you get to work on. Now, in our health data school, you'll be working on healthcare related projects, whether it's a hospital project, in data-driven case study on hospital operations, financial performance in hospitals, and patient care optimization, whether it is a case study that involves transforming, a flat file into a relational data model, in a pharmacy, whether it is an emergency room dashboard or it is a medical center, you're going to be working on some of these types of projects. So that by the time you go out there in the real world, you have a wealth of experience. This is exactly how we are able to bridge that gap. Because now, because you've worked on, projects that relates to hospitals, relates to pharmacies, relates to emergency room, relates to medical centers, and so on and so forth. When you are asked a question like this in an interview, you know the approach to take. That is why it is very important to work in a project-based environment. Now, number 3, how do you gain work experience as a healthcare data analyst in order to show your employers or recruiters that you are the best candidates? How exactly do you do that? In order to gain experience, right, you're going to be working on projects in class. Of course, I talked about project-based learning. That is the first step. You cannot talk about something you don't know. You cannot pour from an empty cup. It's not possible. If you don't have it, you cannot give it. So you're going to get to work on projects. And that is exactly how, when you tell someone, I have 2 years of experience, I have 5 years of experience, they say, fantastic. Can you talk to us about some of the projects you've worked on? You have projects to fall back to. You even say, how about instead of just talking to you, I do a show and tell? How about I show you? How about I share my screen and show you some of the projects that I've worked on? Again, it's the confidence. A lot of times it's the skills, it's the experience and also the confidence that gets you the job. All right. It's not magic and it's not certifications. So you gain experience by, working on projects in class, and then you also get 2 months of an internship with our partners. We partner with an organization in the UK specifically for this. So you're not going to be interning with us. You learn with us for 6 months. And then after your 6 months, you are then moved into our partner company of Dari to get your 2 months of internship. Now you have the unique opportunity of including whether 10 Analytics or Amdari on your CV and on your LinkedIn. Now, what that means is, of course, recruiters can reach out to us when they need a recommendation letter because you can put us on your CV and say you consulted with us. Again, you worked on projects with us. Send Analytics is also in the consulting space. And what that means is we actually have a lot of these organizations reaching out to us and outsourcing projects to us. Now, indirectly, you get to work on these projects in class. And of course, you're building your wealth of experience from there. And then you can put it on your CV that you consulted with us because we are also a consultant organization, right? Now, you are also going to be able to show evidence of your work in a portfolio, right? I also have some portfolios, some sample portfolios linked on my slides. So please make sure that you are filling the attendance form. Make sure that you're filling the attendance form. I see a lot of comments. Not to worry, I'll get to it once I'm done with my presentation. Now, number 4, don't forget, you almost always need a reference to keep the job. Now, it's not enough that your CV is fantastic and then your CV gets your foot in the door and then you get an interview. And then we prep you for that interview. And then we also, help you build your portfolio, show you how to build your portfolio. You're able to show your recruiters your portfolio and then you land the job. It's not enough. You're almost at the finish line, but you're not quite there yet. Because these reputational firms, the next thing they'll ask you for, they probably provide you with a provisional employment contract and let you know that they need you to submit your references. Again, that is where 10 Analytics comes in. So you can put us down. This is just a snapshot of, one of the references that we submitted for one of our students. You can see the NHS Foundation Trust, South Seas Hospital. They reached out to the CEO of 10 Analytics, Adeza Suleiman, and said, hey, we currently have someone we're about to employ. and it puts you down as a reference. Would like to, hear from you and get a recommendation letter from you. And the CEO provided them with that. You need a reference. In order for you, it's not enough to just scale past all the hurdles of hiring. When it gets to the end, they're going to ask you to submit a reference. And of course, feel free to put down our name, Analytics or Abdari. I'll be more than happy to provide you with a reference letter to help you secure that job. So remember, the first thing you want to do is learn. All right? Learn the skills that you need. The next thing you want to do is package yourself. And this is where employability comes in. You want to gain experience by working on projects. We are going to revamp your CV for you. And then we'll also teach you how you can, tailor your CV to multiple jobs. We're going to teach you how to optimize your LinkedIn profile to strategically position yourself for success, on LinkedIn. We're going to teach you how to build your portfolio and how to house your projects in your portfolio. We're going to mentor you. We have weekly mentorship sessions. We're going to prepare you for interviews. Every single time you have an interview, we're going to provide you with job reference and recommendation letters. And then when you land the job, because a lot of people land jobs while they're still in the program with us. We have people landing jobs 3 months in, 4 months in. You land the job, your first 1 month, you're still a bit wobbly on the job. You don't exactly know what to do, how to go about certain things. You get a task on the job that you don't even know how to work on or how to address. Now, you can always come back to us here at Analytics and book a one-on-one session with us, and then we'll provide you guidance on how you can go about that task on the job. That is how to package yourself. And if you're able to do all of this, of course, we will be providing you with links to premium jobs in health tech that you can apply to. So as much as you're out there looking for jobs, we also will be paid. We're paid for it, so you don't have to pay for it. All right. We pay to get access to these jobs every single month. And then we get all of these jobs and then we send them to you to apply. So now, remember, we're giving you the fish, but we're also teaching you how to fish. We're revamping your CV for you. We're going to ask you to submit your CV by the second month. All right. So say you start in February. By the end of March, we'll reach out to you and say, hey, Kiana, please submit your CV. Now you're going to submit your current CV. We will work on your CV for you, but more than that, we're then going to tell you in the future, if you'd like to tweak your CV, this is how you should do it. If you'd like to tailor your CV to fit job applications, this is how you should do it. So you're able to do it on your own as well. So when you're applying to jobs, you're able to tailor your application. And you want to make sure that you're applying to at least 10 jobs per day. Send out at least 10 quality applications, tap into paid job markets that we'll be providing you with. And that is how you're able to get the job. Again, it's a three-pronged approach. You want to learn, you want to package, and you want to apply. That is how you get the job. Now, what is the program duration? You have 6 months learning in class with us. Like I mentioned earlier, you get to work on projects from your very first live class with us. And then you have 2 months of internship. Now, all live classes that you have with us, 100% always recorded and made available to you. You have lifetime access to these sessions. Now, we have a schedule for the live classes. You get your live classes 2 times in a month. So 2 Saturdays out of 4 Saturdays in a month, you have a live class, right? And then we have 2 different timings to support different time zones. There is a morning class, which is 11 a.m. to 2 p.m. West African time. So if you're in the UK, this is a convenient time for you to join. And then we also have the evening class, which is 6 p.m., 9 p.m. 6 p.m. to 9 p.m. West African time, or 10 a.m. to 1 p.m. Mountain time. So if you're in Canada or in the US, this would be a better class for you to join on Saturdays. Now, remember, all of these classes are always recorded. So if for any reason you miss a live class, you have access to the recording of the session as well as the data that was used, the projects that was worked on, and so on and so forth. Now, if you have questions, because I'm sure you're probably wondering, do we just have 2 classes a month? The answer is yes and no. You have 2 marathon live classes a month, but then during the course of the week, Mondays to Fridays, there is an open window where you can book a session with your facilitator at your own convenient time. So you can say, you know what? I have a question. And I'll be free Monday by 12 p.m. So let me book a session on my facilitator's calendar because I'd like to have a discussion. I'd like some extra guidance after the Saturday live class. So you have that opportunity. Mondays to Fridays, you're able to book a session with your facilitator, you have direct access to your facilitator on WhatsApp. So even if you don't want to book a session, you can easily reach out on WhatsApp to ask your question. And then you'll also be provided with pre-recorded videos. So outside of the live classes, outside of the drop-in sessions that happen, Mondays to Fridays, where you're able to select a convenient time for yourself and book a session with your facilitator. We also have what we call watch me do it videos. Now, these are videos that you get to watch, videos of someone like myself. Again, you have professionals that will show you how to work with the different tools, Excel, Power BI. And these are videos that you can plug in and watch anywhere, and you can try to replicate on your own. Now, of course, when you have questions, you bring it to your facilitator on WhatsApp, or you bring it to a drop-in session. Now, we also have mentorship sessions that happen on Thursdays. Every Thursday by 10 p.m. West African time, we have a mentorship session. And then, of course, we switch it up. So we could have two mentorship sessions by 10 p.m. for people in the UK, and then two mentorship sessions for people in the US. So we're going to make sure that the time zones align and it is very convenient for you. But all mentorship sessions, live classes, drop-in sessions, CV optimization sessions, LinkedIn optimization sessions, they are always recorded and you have lifetime access to it. What that means is you can watch it in 2035. All right. Now we have some more success stories. We have Toyi, who was a pharmacist in Nigeria, and she was able to get, a job as a pharmacy data analyst with the NHS when she moved from Nigeria to the UK. So I'm not going to be dwelling too much on all of these success stories because, like I said, we could spend 5 hours talking about the success stories, but just remember that they are linked on my slide. We also have Gad, who went from being a student in the UK to becoming a data engineer with the NHS. All right, a data warehouse and ETL developer with the NHS on full visa sponsorship after his program in analytics. Again, Gad's testimony is linked on my slide. Now, I want us to get to, the actual heart of the matter. We also have Mawutin, who was an operations manager in Nigeria, and then he moved from being an operations manager to becoming a pathology data analyst in the UK with the NHS. Now you can even see attached, all right, is contracts. You're able to see that attached. All right. We also have Judith, who went from being a carer in the UK to being a business analyst. Judith had a background in HR while she was back in Nigeria. And then when she moved to the UK, she knew she wanted more, of course. So she took a program with us, and within 3 months, she was able to land a job. All right. So I'm just saying this to let you know that this could also be you. There are a lot of people who have Evelyn, who was a nurse for over 15 years. Over 15 years of nursing experience, and she was able to transition and move from that into data engineering in health tech. We also have, Dr. Arome, with over a decade of experience as a medical doctor, was able to move into healthcare data analytics. We have Toyi, who was a pharmacist. I talked about Toyi earlier. So many more, so many people. All right, so many people. Once you get the slide, I want you to take your time and go through all of them. Look at Abigail, who went from being a care worker to being a business analyst in Canada. Now, what this shows you is that it cuts across all the different regions. Look at Esther, who went from being a care worker to a contract project officer with the UK Civil Service. Again, it cuts across so many different backgrounds, so many different regions. You have seen testimonies from people in the US, people in Canada, people in the UK. All right. So we also have Ramat, was a customer success rep, no background in tech whatsoever, and she was able to transition and land a job in tech in the UK as well. So I see a hand up. Make sure to just put your question in the chat, and then I will be answering your question. Now, I'm going to end with this. Before I start taking questions, I want to tell you something. This is a new year. You can't stay where you are right now. And this is a candid one-way conversation. But you cannot stay where you currently are. You have to make a change. How do you improve your earning power? Of course, a lot of us were probably scared. What if it doesn't work out? Well, I will tell you this. You need to do it scared. If you're interested in breaking into health tech in 2026, the time is now. Now is when you want to do that. You have to make a change. And, we often fall, this is February already, we often fall victim of, procrastination. And you say, I'm going to do it in 2026. And before you know it, it's December. And you say, you know what, I'll do it in 2027. But then things come up. So you want to make sure. I tell people the best time to get into tech was about 4 to 5 years ago. The second best time is right now. You have to make that change right now. Now, you can join our next cohort. We have a class starting on the 7th of March. However, like I just said, for people who don't want to wait till the 7th of March, we have a class that just started today that you are still able to get into. So, because the sooner you start, the better for you. The sooner you start, the sooner you can land your dream role. All right. So, if you don't want to wait an extra month, March 7th is literally 1 month from now. If you don't want to wait an extra month, you can get into class today, but only if you register and enroll for the classes today. By tomorrow, you'll no longer be able to get into the February class because we always keep our classes small so that we don't have too much crowd, and then we can also offer personalized guidance to every single student. Now, if you would like to join the class that started today, you have to enroll right now. But the next class starts 1 month from now. Now, what exactly is the cost for this? The original price for our program is 1,250 US dollars or 958 pounds for the people joining in from the UK. All right. But right now, by virtue of you being on this session, we have almost times 10 of, the number.
Healthcare business analyst.
Okay. So, Michael, Sarah, your mic is unmuted. Please mute your mic. Thank you very much. So we have a slot available. I'm going to offer 20 people on this call today. 20 people listening to me right now, just 20. I can only do 20. All right. Just 20 people. Instead of paying 1,250 US dollars, the first 20 people will be able to get in with 1,000 US dollars. And there is a payment plan. What that means is, even though you're getting in 1,000 US dollars, you don't have to pay all 1,000, immediately. Now, I want you to take a look at the amount of participants we have on this call. Like I said, first 20 people. My colleague very shortly is going to be dropping the link to enrollments. First 20 people, it is literally the race of the Swift tests. The fastest person, fastest fingers, first 20, you're able to get in with 1,000 US dollars or 766 pounds, and you're able to pay in installments. I'm going to be walking you through that shortly. So what that means, let me show you what that means for you and how you want to navigate this. Now, the link that my colleague must have put in the chat right now, once you click on that link, you're going to see a list of all the programs that we offer. Now, block out the noise and scroll to the bottom. The very last program right here is what you're interested in, health tech. So you want to click on buy now for health tech. Remember, first 20 people. Click on buy now for health tech and it opens up the course description, the curriculum, and so on and so forth. So you're able to see week on week everything that you'll be learning. Now, right here, you see a button that tells you to enroll now. Once you click on enroll now, you're going to be prompted, just like this, to create a free account with us. It's going to take you less than 1 minute. So I expect that some people are already doing this right now on this call. It's going to take you less than 1 minute. All we need is your full name, your email address, and your phone number. Now, once you create an account, let me just sign in. Let me sign in because I already have an account. Once you create that account, you'll then be able to confirm your enrollment. Now, this is what it's going to look like once you create your accounts for health tech. Just give it a few minutes to load. I can see some traffic on this site right now. It looks like people are already jumping in. Fantastic. Now, once you have clicked on that link, once you have created your free accounts, then you'll be able to confirm your enrollment. Now, like I said earlier, we have the February class. It started today, 7th of February. If you want to get started right away, you need to make a payment right now to get started. By tomorrow, you'll no longer be able to register for the February class. But if you don't want to get started right away, all you have to do is select the March class. You select the March class and then you can get started. Now, we have a currency selector right here. So you're able to select your local currency. So if you're joining from the US, you're able to select USD and see the price in USD. If you're joining from Canada, you're able to select Canadian dollars. If you're joining from, the UK, you're able to select pounds. So you're able to switch your currencies as you see fit. So what that means is you don't have to worry about, paying in your having to convert your money to UST. You can pay in your local currency. All right. Now, there's a payments plan. You can either choose to pay everything all at once. And if you choose to pay everything all at once, you're saving up to 37%. So instead of £958, you're paying £651. Or you can choose to pay everything two times, which would mean you're paying £345 two times. Or you can choose to pay everything five times. So there's a 5 installmental payments plan available, meaning that if you want to get in right now, £153, and you're in, you're ready to start classes today, if possible, or next month. The first 20 people. Now, first 20 people, you can choose the 5 installments, you can choose the 2 installments, or you can pay all at once. It just depends on you and what is most comfortable for you. But just select the most convenient payments plan and then click on apply discounts. And then when you click on apply discounts, you're going to be able to confirm your enrollment on this screen. You see a breakdown of when the next payments will be due, and then you are able to make payments using your card. So it's very easy and it's very simple. Now, of course, you're going to be getting a certificate, a globally recognized certificate after this training, and we are globally recognized. We are accredited by the American Council of Training and Development. So this is a certificate that is recognized everywhere in the world. I also have some wonderful resources linked on my slide, so make sure you have filled the attendance form so you'll be able to have access to the slide. Now I want to take questions. So I'm going to be looking in the chat for people who have questions for me. Wow, 91 messages. So Dami says, for someone who does not like coding, what aspect of tech in healthcare suits me? Fantastic question, Dami. I hope I've been able to answer that question already there. So you can just go ahead to register for the health tech program. You can get into healthcare business analysis. You can get into pathology, data analytics. You can get into biostatistics. There are endless possibilities for you, and you will not need to write one single line of code. All right. Let's see if I have more questions. Pamela's iPhone says, for people without healthcare background, after getting the training as a health tech, would you advise we enroll in basic health courses on the side? Now, Pamela, that would be a personal decision if you want to. However, it's not something that you have to do. You don't need to do it, but you might want to do it on your own because, of course, continuous learning is always advised. So if you want to do it, maybe you just enroll in basic health courses on the side, you can do that. But it's not going to stop you from landing your first job in tech, all right? So let's see. Adex says the job market in your examples earlier were people in the US, UK. What about other European countries like Germany, where there are language barriers? Now, like I said, Adek, when I said 3,400 people, best believe there were not 3,400 people from the UK or 3,400 people from the US. It's just that I cannot put all of them on my slide. So we have people from other countries, people from other regions. We have people from Germany, Ireland, people from Russia, even people from Korea, all right? Land jobs, all right? So we're able to do that as well. EJ says, does Analytics help with LinkedIn optimization? Yes, that is one of the add-ons that comes with the registration. So my colleague Daniela already answered that question. Teresa says, hello, I'm a nurse in France. How is the job market after the course like? Do you have testimonials of people from France? Also, how much is the course? I believe I've been able to answer the last part of the question. Do we have testimonials from people from France? 101%. And then how is the job market? Now, remember, for us to be able to do this, we already carried out our regional analysis. Now, what that means was we looked across the different regions. All right. We looked across different regions, whether it's the UK, France, Germany, Asia, Africa, different regions to find out what was in demand in that region. So the job market is very promising. Whether you're in France, whether you're in the UK, whether you're in the US, you can also do your personal research. But there is a lot of opportunity, untapped opportunity that you can get into right now if you start your career in health tech. All right, so let's go. Let me see if I have more questions. What is the fee for the training? I believe I've been able to answer that question. Can this program help someone who is already in healthcare tech as a data analyst looking to level up? 101%. You're looking to increase your earning power. You're looking to start earning more, then this program is also for you. Okay, okay. First 20 people. I see about 4 people have registered. So first 20 people, now it has dropped to 16 people. You need to be very fast. What about the need to study Python? Now, Abubakar, that is a very important question. Again, it depends on you and what you want for yourself. You don't need to study Python to get into health tech. You can study Python if it's a skill that you'd like to acquire, but it's not a skill that you need to get a job. All right. Let's see. Shefumi says, can I use Airtable AI visualize by okay, I'm not sure I understand. Can I use Airtable AI to visualize my reports as against Power BI? Shay, for me, very interesting question. But you'll find out that when you get into the job market, and then you start taking a look at requirements to land a job, they're either going to ask you for Power BI or for Tableau because that is what organizations are using. So even if you know how to use Airtable AI, it is also very important that you learn how to use what the organizations are using because that is what is obtainable in the market today. So you can do that, but it's very important that you have the skill, the Power BI skill or the Tableau skill as well. So still taking a look to see if I have more questions. What of someone who has done data analytics course but not confident? Can a person enroll 100%? Yes, you can. Let's see. Is the certificate recognized worldwide? Yes, it is. Must we wait for 6 months before the internship? What if we finish the program earlier? So you actually, you can actually land a job before the end of your 6 months. You don't have to wait 6 months to land the job. All right. You can land a job before the end of your 6 months, and maybe not even need the internship at the end of the day. Again, it just depends on how much you are able to, focus and really commit to the training. Can a new graduate in nursing who has not practiced land a job as a healthcare informatics analyst? Yes, Adenike. Yes, you can. Greatness says, how do you do internship? So I see my colleague already answered that question. Is it just data analyst training you provide? So no, it's not iPhone. Apologies, I don't know your name. It's showing as iPhone. No, it's not. However, if you're looking to get into health tech, then that is the focus for you. All right. The cost of the training I saw Theresa already responded. Yes, the cost of the training right now is discounted at 1,000 US dollars for the next 12 people. 8 people have registered. Again, the numbers are dropping. So fastest fingers. All right. So let's go. Yasmin says, what roles offer sponsorship? Yasmin, those are the roles that I mentioned earlier. Pathology data analyst, healthcare business analyst, health informatics specialist, clinical data analyst, public health data analyst, and so on and so forth. All right. Uh, so I see a lot of questions that I've already answered. Okay, let's keep going. I'm just going to go to the bottom. Can I have a bespoke training like a crash daily 1 to 2 hours course for 1 month to 2 months of this? So checkwas, it is highly recommended that you don't rush the process, okay? Because that is what has landed a lot of people. You see, there are trainings that will offer you a 6 week boot camp or a 1 month boot camp, a 2 month boot camp. And then after everything, you realize that you're not confident enough. Adenike says, I'm unable to change the currency to CAD. So Adenike, if you're looking at my screen right now, there's a currency selector right here. And I'm sure my colleague Daniela would just respond to you very quickly. But there's a currency selector right by the side, right here. So I'm going to zoom in so you see it. So you see this currency selector, you want to click on it, and then you see a drop down. There are different options that are coming out, and then I just switched it to CAD on my end. All right. So go ahead to use that currency selector and tell me when you're done. All right. I see the numbers dropping. We only have 10 slots left. 10 people on this call have registered. All right. So Lydia says, what would be the best option for someone who has a background in finance with roles in auditing, corporate reporting, finance analysis management, also program coordinator for NGOs. Now I'm working in the healthcare. I'm working as a team leader. So Lydia, for you, the opportunities are endless, really. The first question I would ask you is, are you interested in health tech? If yes, go ahead and register for the health tech program. Then right on our what's it called now? Right on our website. I'm just going to show you what that looks like. Register first. And the reason I asked you to register first is so you don't miss out on the discount. But right on our website, you also have the opportunity. So let me just open a new tab and show you. You also have the opportunity to book for a clarity session that you'd like to speak to a professional. So if you'd like to speak to me personally, you can come on here and then click on this, talk to a career coach. But make sure that you actually register for a course first. All right. And then you can speak to a career coach. The reason for that is so that when you want to register, the discount is not gone. Again, it was only for first 20 people. Now 12 people have registered. We only have 8 slots left. So again, register as fast as you can. All right. Medina says, I'm actually interested in the business analytics of healthcare. How do I go about for enrollment? Go ahead to select health tech. All right, Medina. So that is a big bucket. And then we're going to now separate it into business analysis, data analytics, and so on and so forth. But just select health tech and then go ahead to make payments. Adenike still says, I'm unable to change the currency to CAD. My colleague has responded. Adetola, you said I skipped your question. I'm not quite sure. There are a lot of comments in the chats. NS says, which is highly in demand between data analyst and business analyst. Now, they are both in demand, okay? It just depends on your individual skill. All right. Now, not everybody can be a data analyst. Not everybody can be a business analyst, actually, because it requires a lot of communication. Now, if communication is something that you're interested in, these are two roles that no one is higher than the other. They're both in demand. You just have to select which one you're interested in and which one you have the skill for. As a data analyst, you'll be working in the background. All right. So if you don't like so much meetings, if you don't like constant interactions with people, you just like to do your thing, you're an introvert, then go for data analytics. But if you're an extrovert, you love to be at the forefront, you love to be in meetings, liaising with different stakeholders in the business, talking to the end users, then it's business analysis. But both of them are highly in demand and they fall under health tech. So what you want to do is you want to go ahead to register for health tech. All right. Ogle Samuel says, I'm looking for the terms and conditions to tick. So I'm going to show you on my screen where that is. So let me just walk you through it very quickly. Ogle, so just please look at my screen. So once you select the health tech program, which is the last one on the list, and you click on buy now for health tech, you click on enroll now, which I'm sure you must have done, and then you go ahead to create your account. And then you select the class you'd like to join, whether it's the February class or the March class. And then you select your preferred payments plan. Once you select your preferred payments plan, you click on apply discounts. Now, once you click on this, you are able to confirm your enrollment on this screen. Now, right here, Ogunleye Samuel, just above pay now, you see these two boxes you have to tick. I confirm that my information is correct and I have read the 10 analytics terms and conditions. So once you click on these two boxes, you can then click on pay now. I hope that helps. All right. Okay. So Cardine says, please retype. Please retype your question, Cardine. Greatness says, do you train for general data analysts? Yes, we do, Greatness. Modinat says, I'm actually interested in the business. How do you go about enrollment? Okay, I believe my colleague already answered that. Temitope says, hi, I've done a program. My domain of interest. Can I move straight to Amdari on work experience in this domain? Yes, you can, as long as you've taken your program with us here at Analytics. Temitope. Adenike says, thank you, done. Fantastic. Welcome on board. Carlin says, can AI replace these roles? No. So if that was the question that I missed earlier, Carlin, the answer is no. Like I said earlier, we made sure to infuse AI in the curriculum. Now, the reason for this is very simple. I tell people, AI alone cannot replace roles. AI alone cannot take over jobs. People who know how to leverage AI, who can use AI, will take jobs away from people who cannot. So, Carlin, picture this. If you're on a job right now and it takes you 10 days to complete a particular task, maybe there's a task that you need to do that is very, bulky and it takes you 10 days. And then I come around and I, proposition your company and I tell your company that I can do the same task in 5 hours. Who do you think they're going to prefer? They'll probably lay you off and then pick me because I know how to leverage AI to make my work faster. So you're leveraging AI to your advantage and it is part of the curriculum. right? You're not just learning the data analytical skills or the business analytical skills. You're also learning how you can use AI as a business analyst or as a data analyst. I hope I've answered your question now, Carly. Uh, Bassi says, what if I don't make the first 20? Can I still have a clarity one-on-one session? Yes, you can. But just bear in mind that you'll be paying more by the time it's time for you to register. You'll probably be paying $1,250. So if you want to save $250, it's best you at least make a minimum deposit. You can go for the 5 installmental plan and then still have a one-on-one clarity session. But if you don't want to do that, that is okay. Whether you pay or not, the clarity session is free. Okay? Greatness says, please, how do I select data analysts? All right, Greatness. So we'll be on the lookout for you. So my colleague just responded, instead of going for health tech, you can actually select data analytics. However, whether you're going for health tech or the general data analytics, just know that you are going to get to work on projects and you get to build your portfolio. So I'm just going to show you how to do that right here. Once you click on the link that my colleague sends, remember you see a list of all the courses that we offer. So instead of scrolling to the bottom to select health tech, you can select the first one on the list, which is data analytics. All right. Okay. Lydia says, what would be the best option? I think I've answered this question. Okay. How do we book a clarity session? So right here on the sites, there is this option here at the top right. It says talk to a clarity coach. So you see this? This is what you want to click on if you'd like to book a clarity session. So I am going to have to stop it here because I see a lot of questions and we're going to be here for a very, very long time. Greatness says, please, can you kindly explain the difference between health tech analyst and data analyst? You just want to better understand. Now, a data analyst is a generalist, Greatness, right? What that means is you can work in an educational technology company, you can work in, a finance company, you can work in a bank, you can work in a school, you can work for Amazon, you can work anywhere. However, if you want to get into healthcare, you need to work on healthcare related projects. So now let me explain. A healthcare analyst is a data analyst that has worked on healthcare related projects and thus has healthcare experience that will help them land a job in healthcare. So a health tech analyst is really a data analyst. But because you're interested in healthcare, you have gone ahead to learn with healthcare related projects. I hope I've been able to answer that. So it's the same thing, but then one of them would get more healthcare projects because that is what they're interested in. All right. So Osato, my colleague just responded to you. Kindly send an email to the accounts, to the email address provided. Adenike says, how am I going to get an evidence of payment? You should get an email shortly, Adenike. So I believe that would be all. I have been able to answer some of the questions. If I missed your question, just know that you can also have a one-on-one with myself or any other person on the team, but go ahead to register. We currently already have just 4 slots left. Just 4 left. So register, make at least your initial deposit, and then you can, of course, select that you'd like to speak to a career coach. Now, Bassi, the website has already been dropped. My colleague will be dropping it again shortly, the link to the website. Then you can select that you'd like to speak to a clarity coach. Now, if you choose a program, say, for example, you selected and you registered for data analytics, you made your initial deposits, but then you want to move to, health tech, right? You can do that at no extra cost. Just make sure you pay for a program using the discount right now, tonight, and then select that you'd like to speak to a career professional. And then after the conversation, if you want to switch from one program to another, we can do that for you. Okay. So thank you so much, everybody, for joining in and, just listening to me. It's been a wonderful, wonderful 1 hour, 30 minutes that I spent with you. Thank you so much. And I'll look forward to seeing a lot of you in class, in this February class or in class for next month. Remember, we only have 4 slots left. All right. If you are looking to register, if you're looking to get it with a discount, my colleague just puts the link in the chat again. 4 slots left for the discount. So what that means is the 5th person to make payment will pay the full price. So do with that information what you may. Thank you for listening to me once again, and good night. Oh, I see one question from Adenike. Please, where am I going to copy to? Where am I going to copy the code to? Please check your email, Adenike. And if you didn't get the email, please check spam. All right? You must have gotten the email. Thank you so much, everybody, and please enjoy the rest of your day.
In a new name, I can't hear you.